child who was ill, whenever I used to ring up, I had the number of the mother and the father. Whenever I used to ring up the mother, she would tell me to talk to the father if he was not at home. And if he was at home, she would hand the phone over to him. She never spoke to me personally, on the phone at least. So he always made all the decisions. He always discussed. He was the one who would discuss everything. So in our country, very often it is the husband or the father of the child who will make all the decisions, or the grandparents, the grandfather. So we must involve the mother also if we think that especially a female child is being neglected. Another problem, social problem in our country is due to financial problems, many patients are discharged with LAMA, that is leave against medical advice. So even if a child could be potentially cured or their life prolonged, they may leave because of financial problems. So these issues must always be considered whenever we hold any discussion with families. The common ethical dilemmas that occur, this is in adult patients as well as in children. Artificial nutrition and hydration. Artificial nutrition and hydration at the end of life is not normally recommended. Studies have shown that they do not have any positive effect on the life of the patient. In fact, they may prolong the dying process, and the dying period, sorry. But the thing is that feeding a child or feeding a patient is a very basic need of the mother also, to show that she cares. It's a very basic act that she does. So for her not to feed the child, it is very difficult for them to abandon this. Very often we find mothers telling us or fathers telling us to put a drip, even in the home care setting. So normally our response is to discuss the situation with the family and try to persuade them that this is not a proper way to go about things. Sometimes we can persuade them, but sometimes we cannot. Another common ethical dilemma is the principle of double effect. In India, we have not been using opioids for very long, at least most of us, and very often doctors feel that giving opioids will hasten death, especially in children. So we should not, where research has shown that if you give opioids in pharmacological doses and titrate it carefully, it very rarely causes respiratory depression. So this should not be a problem. DNR and withholding and withdrawing of non-beneficial treatment in hospitals is always a problem, especially with children. Almost every parent wants to treat the child until the end. They want that the child should be resuscitated. So this takes a lot of communication, sitting and talking with the family, sitting and discussing everything with them again and again to make them understand. So when we have conflicts, it is over goals of medical care. Parent or provider, they promote futile care, and parents refuse recommended treatment. So there is loss of trust, and often because of the prognostic uncertainty also there is a lot of conflict. The ideal would be a shared decision making, that the physicians and the parents engage in mutual exchange of information about achievable treatment and patient goals. Where indicated, each may defer certain decisions to the other. The family knows more about the child and what the child wishes or what the child is like, and the physician knows more about the prognosis and the treatment. So the decision making should be shared. So these are certain guidelines that we should follow when we have to make some ethical choices about treatment. All treatment decisions should be made in context of patients and family values and the diagnosis and prognosis. Risks and benefits of any treatment option should always be discussed. Everything must be discussed in great detail with the family, and we must use a language that they can understand, and so that they can make the correct decision. Everything that is discussed must be documented, and as far as possible, shared decision making. So communication is the answer, it is the key to having good decisions at the end of life, good communication between team members, regular communication between the medical and team and the family, shared decision making, compassionate, sensitive conversations with family members. Alongside, all the emotional needs of the family must always be addressed. And if possible, though in our country I have not seen it, depending on age and development level of the child, they should be included in the conversation. I also had a child around 16 years. He knew he had cancer, but he never knew his prognosis. In fact, his mother and his sister, only his father knew what the prognosis of the child was. So I don't know if it is happening. In summary, healthcare professionals regularly face ethical problems, especially in cancer patients and other advanced diseases. It is very important to be honest and to have regular communications with the family members, be compassionate and understand what they are going through, and as far as possible, excellent palliative care throughout. Thank you.